On this Thursday night, essential, unprotected from COVID, and at risk. Frustrated workers on the front lines still waiting for their shot.
The pandemic's not going to take a holiday.
The mounting pressure to speed up Canada's vaccine rollout. Too strict or too lax? The growing anger from both sides over Alberta's new restrictions. Violence erupts in Northern Ireland.
The courage to disperse immediately.
What's fueling flaring tempers and rising tensions? And dance of joy. Why Canada's famous Bhangra sensation has a new reason to celebrate.
Global National with Donna Friesen. Reporting tonight, Farah Nasser.
Good evening, and thanks for joining us. Glad to be with you tonight. We're going to begin with what most people are feeling right now: frustration. Multiple provinces are facing a major resurgence of COVID-19. There are questions about how we even got here. And Canadians at the end of their rope are now being told how important it is to once again stay home in hot zones. All of this while we wonder if we're really vaccinating as many people as possible. So far, roughly 6.4 million Canadians have received at least one dose. That's about 16.9% of the population. Millions of Canadians are still waiting in line, and of course, with the variants in the mix, case counts are accelerating fast. Over the last week, more than 6,500 people tested positive on average per day. The number of confirmed variant cases has surged past 16,000. Now, we've been saying it for a year. Frontline workers of all kinds have been heroes this pandemic. And if you want to talk about frustration, imagine being one of them. Many not qualifying yet for the vaccine, yet putting themselves at risk going to work, some in high-risk areas, and then hearing of vaccines in freezers. David Akin has tonight's top story.
In some busy grocery stores, a worker could be exposed to 1,000 strangers every day. Reason for concern, reason workers want a vaccine ASAP.
The worry, of course, is quite high, knowing that these variants especially would affect my age group in a more detrimental way.
Nathan LeBlanc-Fortin, a cashier, is booked to get his first jab in May, but he's worried what might happen until then.
It's still frustrating because we know that the pandemic's not going to take a holiday. There's still 30 possible days of maybe coming into contact with someone with a positive case.
Lots of people are doing essential work to feed and care for Canadians. A doula, for example, helps women in their home before, during, and after pregnancy. Without a vaccine, doula Griselda Hernandez wonders if she can continue to serve families safely.
Sometimes you kind of just start thinking, well, should I keep supporting these people in need, or should I just step aside and just stay at home?
There is no quick fix, and it can be frustrating for many because on any given day, Canada has hundreds of thousands of vaccines in freezers, not in arms. But that, experts say, is how it has to work. When the first vaccines arrived in Canada on December 13th, all of the doses, 100%, went into the freezer. But then vaccination programs ramped up, and for the last several weeks, on any given day, about 25% of all doses are in a freezer. It's a buffer that lets provinces manage their own vaccine programs. But in the last month, that buffer has edged up. On Monday, 35% were in a freezer. That's a high not seen since the middle of January.
On Mondays, we have a very regular delivery schedule with Pfizer. And on Mondays, you will see a spike in numbers.
In other words, that's normal, but there is room for improvement.
I think it's fair to say that, yeah, of course, we should be picking up the pace of vaccination. But in the same breath, you have to have some reserve in the freezer.
Picking up the pace will be up to each province. The federal government is reluctant to step on provincial toes when it comes to vaccine delivery or priority lists.
It is up to health authorities in the provinces and territories to decide how best to apply it in their immunization programs.
David Akin, Global News, Ottawa.
Still with frontline workers, a mass vaccination clinic is being set up at the Cargill meatpacking plant in High River, Alberta. That is the site of Canada's largest outbreak last year. 2 employees died. Nearly half of the 2,200 workers contracted COVID-19. The immunizations are part of a pilot program and will be administered by the company's own team of nurses. There are hopes the pilot could expand to other meat processing plants vulnerable because of tight working conditions and cultural barriers. The workers are part of Alberta's next phase of vaccine rollout, expected to begin in a couple weeks. And it cannot come soon enough. Alberta now has the most cases per capita in the country. More than 12,000 people are infected with the virus, a 41% increase in just 1 week. Many doctors say new restrictions won't be enough to flatten the curve. But Premier Jason Kenney is facing a revolt from members within his own party, critical of his latest public health measures. There is anger and there is frustration on all sides. And as Heather Yourex-West explains, the Premier may only have himself to blame.
If you try to find a middle ground on the highway and stand there, you tend to get run over.
As Alberta's third wave builds, Premier Jason Kenney is facing opposition from all sides.
If we don't institute more strict public health measures, that inevitably the health system will be overwhelmed.
What Albertans, particularly, in Cypress Medicine Hat, are asking for is more freedom.
While doctors' groups say the province's new restrictions won't be enough to bend the curve, more than a quarter of Kenney's caucus believe the measures go too far.
I respect their responsibility as elected representatives to articulate concerns like that. But at the end of the day, the government must decide how best to protect lives and the healthcare system.
Still, the Premier says he expects his members to respect public health orders and encourage constituents to do the same. Anyone that does not will be kicked out of caucus. But the mixed messages from elected officials are having an impact.
We have the numbers, we are united, and we are not closing.
On Tuesday, the owner of a Calgary boxing gym took to social media to make his intentions known, while the Grace Life Church outside Edmonton has been defying orders for months. It wasn't until this week that the RCMP moved in to erect barricades to shut the church down.
The fact that we've got people in positions of leadership, people who are elected officials, making claims that the rules are too stringent is entirely unhelpful.
But over the past year, the Premier's own messages have been inconsistent too.
A week ago, the Premier was singing a very different tune. They were willing to tolerate some rise in the hospitals, some rise in the case numbers, thinking that they wouldn't go up high enough to threaten the hospitals.
These variants...
The virus may have forced the government to change course, but many Albertans don't appear to be following along. Heather Yourex-West, Global News, Calgary.
Quebec is tightening restrictions to try to counter rising cases and fast-spreading variants. Emergency measures have been extended in 3 regions, including Quebec City, and start this Sunday. The curfew in Montreal and Laval will shift back to 8 p.m.
The virus is present everywhere, and the variant is more contagious. I ask you to reduce your contacts as much as possible. I know it's difficult, but it's the only way to stop this third wave.
And one of Quebec's most worrying hotspots is the Quebec City region. It's dealing with a major spike linked to new variants. And one case in particular is a perfect example of the exponential growth experts keep telling us about. Amanda Jelowicki reports on an outbreak at a gym that led to more than 400 cases.
Quebec City's mega fitness gym reopened early last month after months of pressure from outspoken owner and COVID critic Dan Marino. Well, many are now blaming his gym for a staggering COVID outbreak in the Quebec City region.
I think it really, unfortunately, serves as a serious warning sign to how quickly things can spiral out of control with these easily transmissible variants.
The gym reopened on March 8th after closing in October. On March 26th, public health linked a few cases to it. Officials closed the gym March 31st, blaming the owner for ignoring sanitary measures. 204 people have caught COVID directly from the gym, another 236 indirectly. It's caused 38 outbreaks in the region. Since March 23rd, Quebec has seen an 850% increase in COVID cases.
All it takes is a few people to do a few things and a few super spreader events, and all of a sudden you have exponential growth.
The family of Etienne Desrochers-Jean claimed he contracted COVID at the gym. The 40-year-old died from the virus this week.
The first feeling you get, you say, my God, I'm lucky because I got through it a bit easily. It didn't. So
Dominique Lelièvre didn't know Desrochers-Jean. Despite respecting rules, he also contracted COVID from the mega gym.
Most people in Quebec City only think about the gym and blame the gym for schools were closing. When you say that you are a customer of this gym, you kind of, people don't like you very much.
The Quebec City outbreak is the worst the area has seen since the pandemic began. Experts say loosening restrictions too soon can cause problems.
It's a fair statement that all of these preventative measures work a lot better if you put them in place before you have large transmission.
Now the fear is what's happening in Quebec City could also hit other regions of the province. Amanda Jelowicki, Global News, Montreal.
In BC, health officials are changing the way they test for COVID-19 variants.
So our strategy moving forward, given this high rate of transmission or high rate of VOCs that we're seeing in British Columbia, will be to no longer routinely sequence for confirmation. We just assume that those screen positives will be the variants.
The province says that variants, especially the one first detected in the United Kingdom, are driving new case numbers. In the past 24 hours, 1,293 new COVID-19 cases were detected in BC. That is the highest number of daily cases in the province since the pandemic began. In Ontario, an expert group of scientists advising the province on the pandemic is recommending that doctors ration doses of a drug used to treat COVID-19 patients because of supply shortages. Now, the move comes as Ontario hospitals face a record number of COVID patients fighting for their lives in the ICU. And other provinces are in a similar dire situation. Eric Sorensen reports on the side effects of this drug decision.
It is a shortage we don't hear as much about. As intensive care units fill up, straining hospital capacity for beds and ventilators, there is something else here that saves lives that is in short supply. A drug called tocilizumab. Along with the workhorse steroid dexamethasone, the drug treats patients whose immune systems cause inflammation in the lungs that can be life-threatening. And doctors have seen it work wonders.
People that I previously saw would rapidly progress to requiring a mechanical ventilator or high-dose oxygen will kind of almost level off, and then suddenly, a couple of days later, they're better, which I found remarkable.
One fixed dose of tocilizumab can be up to 800 milligrams, but Ontario's COVID-19 Advisory Science Table now recommends, in light of ongoing drug shortages, a fixed dose of 400 milligrams should be used for all eligible patients, and no follow-up. A second dose should not be given to any patient because of shortages. One smaller dose is deemed effective, but the problem is there are too few doses available in some Ontario hospitals.
Everyone around the world who's seeing COVID wants access to this drug. It's potentially life-saving. The challenge that we have here is there's really just insufficient supply.
The drug, also known as Actemra, is produced under patent by one manufacturer, Hoffmann La Roche. Ottawa has secured a supply, but with high demand, Health Canada says it is working on shortages of therapeutics.
With all the parties involved, Health Canada, the Public Health Agency, looking at the clinical experts, we're looking at the ways to address that situation.
By our estimations, for every 25 patients who receives this drug, one more patient will be alive who wouldn't otherwise be alive.
The drug is already prescribed for rheumatoid arthritis, and doctors say any redistribution cannot come at the expense of patients who already use the drug.
It's difficult to manufacture quickly, and we do really want to make sure that we're not taking it away from somebody else who really needs it.
Tocilizumab is not seen as a magic bullet, but as serious COVID cases climb in ICUs, doctors say they will need more of it. Eric Sorensen, Global News, Toronto.
Northern Ireland is calling for calm tonight. Coming up, what's ignited days of riots and unrest. Days of unrest in parts of Northern Ireland, where tonight police are out in force in what some are calling the worst violence in years. Politicians of all stripes are calling for calm, but as Crystal Gamansing explains, there's concern the situation could escalate even more.
A smoldering bus igniting past pains and flaring current frustrations.
We must stand united in appealing to all concerned to refrain from further threats or use of violence.
The crowd should disperse immediately.
The violence in Northern Ireland is floating on top of historic simmering political tensions and new ones caused in part by Brexit. In keeping with the 1998 Good Friday Agreement that mostly ended the deadly violence of the Troubles, there's no border between the Republic of Ireland and Northern Ireland. Ireland is still in the EU, Northern Ireland is not. But with Brexit came a protocol leaving Northern Ireland in the EU's market for goods. So there are checks and import rules on products arriving from Britain. That frustrates UK loyalists living in Northern Ireland.
What we're seeing with the violence specifically being, located at the peace walls and directed at the peace walls appears to be a narrative where these people are saying the peace is broken. The Belfast Agreement or Good Friday Agreement promised no borders.
Authorities say criminal organizations and militias are exploiting young people and using them to destabilize the community. More than 50 officers have been injured as demonstrations have escalated over the past several days to riots.
And no brick, no bottle, no petrol bomb thrown has achieved or can ever achieve anything but destruction, harm and fear.
Power in Northern Ireland is shared between those who support being a part of the United Kingdom and those who want a united Ireland. They've jointly called for calm, but it's unclear if they'll be able to avoid being pulled into the street fight. Crystal Gamansing, Global News, London.
In the U.S., some long-awaited action aimed at curbing that country's deadly gun violence.
Gun violence in this country is an epidemic, and it's an international embarrassment.
President Joe Biden has announced new gun control measures after the mass shootings in Georgia and Colorado. A series of executive actions direct the Justice Department to restrict weapons known as ghost guns. They're largely homemade without serial numbers. Restrict stabilizing braces that turn pistols into rifles. Resume firearms tracking that stopped more than 20 years ago. And draft red flag laws allowing relatives and police to ask a judge to keep weapons from people who pose a danger to themselves or others. Still ahead, the tool that could tackle future pandemics. As vaccination campaigns ramp up, there is also a push to create a vaccine that would provide protection from all coronaviruses. COVID-19 is the third major outbreak of a coronavirus in the past 2 decades. And as Michael Couture reports, researchers say we need to be ready for the next one.
It's not your ordinary COVID-19 vaccine. This shot, developed at the Walter Reed Army Institute of Research, is entering phase 1 of clinical trials, but the lead researcher believes it could be the basis for a universal coronavirus vaccine.
Not just the different variants, the different strains, but potentially other coronaviruses in that same family tree.
It's one of many efforts across the globe to develop one vaccine that will protect people against all strains of coronavirus, even those that haven't crossed to humans yet. Canadian researchers are also working on one, led by Dr. Volker Gertz at the University of Saskatchewan.
The whole idea is having vaccines before a new disease even emerges would save you all these millions of lives that you lose during that year and the trillions in dollars in economic losses.
Now, the idea isn't new. Following SARS in 2003, Maria Elena Bottazzi at the Baylor College of Medicine started working on a pan-coronavirus vaccine, but funding dried up in 2016 as the focus turned to other viruses like Ebola and Zika.
I think there was a little bit of a loss of memory that coronaviruses could return. Too bad that they return so quickly.
COVID-19 is the third major outbreak of a coronavirus in the last 2 decades. This latest one has a lower mortality rate compared to SARS in 2003 and MERS in 2012. Wayne Koff of the Human Vaccines Project believes now is the time for collaboration to create a universal coronavirus vaccine.
We've never had tools like we have now in terms of artificial intelligence and machine learning. So it simply is not just a biology problem.
Artificial intelligence is what helped map the genomic sequence of the SARS-CoV-2 strain. Researchers say it'll take a cross-disciplinary and multilateral effort to find the Achilles heel of all coronaviruses so that they might be able to develop a vaccine. It will also take time, money, and political will. However, researchers believe it's worth putting in the effort now before the next pandemic hits. Mike Lecoultre, Global News, Ottawa.
Next, we're going to tell you the reason for this celebratory Bhangra dance. A Canadian man turned internet sensation and international inspiration is sending the world more positive vibes. Gurdy Pander received his second shot of the COVID-19 vaccine, and his latest viral video has a powerful message.
It's important to take care of each other. It's important to stand for each other. And please go and get your vaccine.
Throughout the pandemic, he's been spreading the love with his daily dances and has built a massive following from his cabin in the far north. Thank you, Gurdeep, for putting a smile on our faces. That is Global National for this Thursday night. I'm Farah Nasser. It's been a pleasure to be with you. Tonight, Your Canada is the sunrise over Pointe-Claire, Quebec. Thank you so much for watching. Robin Gill is going to be with you tomorrow. Until next time, take care of yourselves and each other. Good night.